Stroke in children is a huge challenge, especially because the vast majority of people don't expect that children also can have strokes. So first of all, the awareness of the population, of parents, GPs, other physicians, that children have a stroke is very low. And if they have a stroke, they can mimic other diseases. So they can mimic migraine, seizures, and also other neurological diseases which are more common in children. If a stroke happens, some signs and symptoms are the same as in adults, so they can have a hemiparesis, they can have speech problems, but they can also have other symptoms. So 1/3 of children presenting with a stroke, they have seizures. And since seizures are quite common in children, people often don't think that it could be a stroke. So that's a major challenge. So first of all, there are no randomized trials how we should treat children with an acute ischemic stroke. And especially this is also understandable because who would randomize his son, his daughter into a trial if we know that we have such a strong evidence in adults that thrombolysis or thrombectomy works? On the other hand, as I mentioned this morning in my presentation, this etiology of the stroke is different in children and adults. So adults often have an embolus of the heart going up to the brain or an atherosclerosis, whereas children can have emboli from the heart, but most often they have an inflammation of the vessel wall. It's called a vasculopathy. And this vasculopathy makes things more tricky. So we cannot conclude that the treatment approaches we have in adults are the same also in children. It's hard to say because, as already mentioned before, there are no randomized controlled trials. The only way we can approach this question is by observational data. And that's what we have done in Switzerland. We have an excellent collaboration with the neuropediatrician in Switzerland. They have a nationwide network. It's led by Professor Maya Steinlin, and she has a tremendous job because she was collecting all stroke patients for many years in Switzerland. So what we did, we compared the outcome of children receiving thrombolysis and thrombectomy with young adults in a matched control. And what we could see that complication rates are more or less the same, mortality is the same, and also the outcome is more or less the same. Nevertheless, what we saw is that thrombectomy can work, but for intravenous thrombolysis, often children are coming too late for this treatment. Well, from my talk, the key message is that, first of all, it still remains a major challenge. We are not 100% sure whether we can that the same treatment approaches as in adults are working in children, so more research has to be done. And I think in the future what we also have to aim for is individualized treatment decisions based on imaging information and clinical data to get the optimal treatment for each individual.